Hey everyone! Welcome back to our channel. Today, we're diving into a fascinating and often bewildering journey, puberty. Whether you're experiencing it yourself, supporting a loved one, or just curious about what it all means, puberty is a time of incredible change. From the awkwardness of growth spurts to the whirlwind of emotions, we'll explore how boys and girls experience this transition differently, and why understanding it is so important. So, stick around as we break down the science behind those transformative years and shed light on common challenges like menstrual disorders. Let's get started. Puberty. Puberty is the time in life when a boy or girl becomes sexually mature. It is a process that usually happens between ages 10 and 14 for girls and ages 12 and 16 for boys. It causes physical changes, and affects boys and girls different. Puberty is the process of physical changes through which a child's body matures into an adult body capable of sexual reproduction. It is initiated by hormonal signals from the brain to the gonads, the ovaries in a girl, the testes in a boy. In response to the signals, the gonads produce hormones that stimulate libido and the growth, function, and transformation of the brain, bones, muscle, blood, skin, hair, breasts, and sex organs. Physical growth, height and weight, accelerates in the first half of puberty and is completed when an adult body has been developed. Before puberty, the external sex organs, known as primary sexual characteristics, are sex characteristics that distinguish boys and girls. On average, girls begin puberty at ages 10 to 11 and complete puberty at ages 15 to 17. Boys generally begin puberty at ages 11 to 12 and complete puberty at ages 16 to 17. The major landmark of puberty for females is menarche, the onset of menstruation, which occurs on average between ages 12 and 13. For males, first ejaculation, spermarch, occurs on average at age 13. Characteristics of adolescent. In girls, the first sign of puberty is usually breast development. Then hair grows in the pubic area and armpits. Menstruation, or a period, usually happens last. In boys, puberty usually begins with the testicles and penis getting bigger. Then hair grows in the pubic area and armpits. Muscles grow, the voice deepens, and facial hair develops as puberty continues. Both boys and girls may get acne. They also usually have a growth spurt, a rapid increase in height, that lasts for about 2 or 3 years. This brings them closer to their adult height, which they reach after puberty. Characteristics of puberty. The characteristics of puberty are directly related to the development of secondary sexual characteristics in both males and females. These mental and physical changes during puberty in males and females are briefly explained below 2 sections. Secondary sexual characteristics in males. The physical changes in boys during puberty take place due to increased secretion of testosterone. Some of the characters are: 1. Growth of body hair, such as facial hair, underarm hair, pubic hair, etc. 2. Enlargement of the larynx or Adam's apple and deepening of voice or voice cracking. 3. Increased stature. On average, adult males are taller than adult female. 4. Heavier skull and bone structure due to increased bone density. 5. Development of muscle mass and an increase in strength. 6. Broadening of chest and shoulder, shoulders wider than hips. 7. Increased secretions of oil and sweat gland. Secondary sexual characteristics in females. Secondary sexual characters in females are seen due to the secretion of higher levels of estrogen. These are: 1. Development of mammary glands, enlargement of breasts and erection of nipples. Increase the growth of body hair, prominently observed in underarm and pubic areas. Widening of hips. It should be mentioned that females have a lower waist to hip ratio than adult males. Labia minora. The inner lips of the vulva may grow more prominent and undergo color changes with the increase in stimulation related to higher levels of estrogenic secretion. Menstrual problems among young women under 18 YRS. Menstrual disorders are a disruptive physical and/or emotional symptom just before and during menstruation, including heavy bleeding, missed periods and unmanageable mood swings. Some women get through their monthly periods easily with few or no concerns. Their periods come like clockwork, starting and stopping at nearly the same time every month, causing little more than a minor inconvenience. However, other women experience a host of physical and/or emotional symptoms just before and during menstruation. Disorders. There are several types of menstrual disorders. Problems can range from heavy, painful periods to no periods at all. There are many variations in menstrual patterns, but in general women should be concerned when periods come fewer than 21 days or more than 3 months apart, or if they last more than 10 days. Such events may indicate ovulation problems or other medical conditions. Abnormal uterine bleeding, AUB, which may include heavy menstrual bleeding, no menstrual bleeding, amenorrhea, or bleeding between periods, irregular menstrual bleeding. 2. Dysmenorrhea, painful menstrual periods. 3. Premenstrual syndrome, PMS. 4. Premenstrual dysphonic disorder, PMDD. Abnormal uterine bleeding. Abnormal uterine bleeding, AUB, is any deviation in normal frequency, duration or amount of menstruation in women of reproductive age. Normal menses. Frequency: 21 to 35 days. Duration: 3 to 7 days. Volume: 30 to 80 mls. Abnormal uterine bleeding can occur as spotting or bleeding between your periods, for longer days than normal, heavier than normal. Types of uterine bleeding disorders: amenorrhea, absence of menstruation. Polymenorrhea, frequent menstruation at regular intervals, less than 21 days. Menorrhagia, excessive and/or prolonged menstruation at regular intervals, greater than 80 mls. Metrorrhagia, excessive and/or prolonged menstruation at irregular intervals, greater than 80 mls. Menometrorrhagia, both. Intermenstrual bleeding, episodes of uterine bleeding between regular menstruation. Hypomenorrhea, scanty menstruation. Oligomenorrhea, infrequent menstruation, greater than 35 days. Causes: every woman's menstrual cycle is different. On average, a woman's period, menstrual flow, occurs every 28 days, although cycles may vary between 21 and 35 days. Menstruation flow normally lasts about 3 to 7 days. Young girls may get their periods anywhere from 21 to 45 days or more apart. For most women, female hormone levels change every month. The hormones estrogen and progesterone are released as part of the process of ovulation. When a woman ovulates, an egg is released. AUB can occur when the ovaries do not release an egg. Changes in hormone levels cause your period to be later or earlier. Your period may sometimes be heavier than normal. AUB is more common in teenagers or in premenopausal women. Women who are overweight also may be more likely to have abnormal uterine bleeding. In many women, abnormal uterine bleeding is caused by a hormone imbalance. It can also occur due to following causes: thickening of the uterine wall or lining, uterine fibroids, uterine polyps, cancers of ovaries, uterus, cervix, or vagina, bleeding disorders or problems with blood clotting, polycystic ovary syndrome, severe weight loss, hormonal birth control, such as birth control pills or intrauterine devices, IUD, excessive weight gain or loss, more than 4.5 kilograms, infection of the uterus or cervix. Symptoms: abnormal uterine bleeding is unpredictable. The bleeding may be very heavy or light, and can occur often or randomly. Symptoms of abnormal uterine bleeding may include bleeding or spotting from the vagina between periods. Periods that occur less than 28 days apart, more common, or more than 35 days apart. Time between periods changes each month. Heavier bleeding, such as passing large clots, needing to change protection during the night, Soaking through a sanitary pad or tampon every hour for 2 to 3 hours in a row. Bleeding that lasts for more days than normal or for more than 7 days. Other symptoms caused by changes in hormone levels may include excessive growth of body hair in a male pattern, hirsutism, hot flashes, mood swings, tenderness and dryness of the vagina. A woman may feel tired or fatigued if she loses too much blood over time. This is a symptom of anemia.